Healthy kids learn faster and better, consume less costly health care, and are far more productive over their lifetimes, which is good for the child, their family, the community, local employers, and by extension, the economy. At the same time, holistic health care, caring for the whole person across different care settings, has been proven to yield the best outcomes in the least amount of time and for the lowest cost. This is because everything is connected. Health, education, and the economy, just like mind, body, and spirit. Balance is key. For this reason, we need to take a balanced and systems approach to the biggest challenges that are facing our nation in the areas of health, education, the senior and social services, and community development. In other words, meaningful and sustainable job creation that strengthens and expands the safety net so it can be there for those who need it most. The best part is we can act locally, but think nationally and globally. Because when we care for that which serves our common interest, everyone wins.
When is the best time to plant a tree?
25 years ago.
When is the second best time to plant a tree?
Now.
Fires.org are the roots that reach deep into the soil which hold the tree firm. Coming up through the ground is the tree trunk. The tree trunk represents the toolkit, which is the program which connects all of the organizations, all of the interventions, all of the services. And then there are 5 branches that come from the trunk. Those 5 branches represent the 5 pillars of an empowered community: public health, social services, aging services, education, and community development. And connected to those branches are hundreds and sometimes thousands of leaves. And those leaves represent the organizations, the services, programs, providing the resources to the community. Fruit, sweet fruit, which represent the outcomes, the positive results, the testimonies, the solutions that are tracked, that are measured.
And so that's how trees, roots, trunk, branches, and leaves work together to produce fruit that
benefits, nourishes, and feeds the community. Starting with yours.
So, how are we going to do it? In 5 simple steps. Step 1, tailor fires to meet the needs of the local community and target audience.
Step 2, have an effective membership campaign where you get the nonprofits, the school districts, as well as the faith community to agree to a project that serves the needs of the local community as part of the same expanded care team.
Step 3, tailor interventions to work in schools so that we can meet the needs of our most prized assets and our future leaders, our children.
Step 4, reinforce these interventions in the community and expand them to meet the needs of other vulnerable populations, whether it's poor seniors and families dealing with chronic diseases and cancers, or if it's dealing with caregivers who have a variety of needs because they give it all. But most importantly, we have to, in step 5, develop a caregiver support network and a care transition program so that we can improve compliance with self-care and discharge instructions, and at the same time, reduce the likelihood of complications, ER visits, and readmissions. It's in this way, in these 5 simple steps, that we can strengthen and expand the public health and social safety net so that it serves the needs of the most vulnerable and costly healthcare consumers among us.
And this is an effective way to prepare our nation, our states, our counties, and families to address the long-term care crisis that will soon engulf our nation if we do it as a team.
This is the kind of change we can believe in because it delivers more in use value and savings than it costs to sustain itself and expand.
We'll be up and running in select locations before our open enrollment begins for the Affordable Care Act in 2014. What's more, we'll be up and running during the school year and before the upcoming election. If elected officials really care about their constituents, then at a minimum, they should support this program or have something better to offer. Otherwise, they should voluntarily step down and stop forwarding the best interests and the will of their constituents.
It's in this way that we put the power back into the hands of we the people. So we have a 3-phase project plan, starting with solutions for school-age kids. We have everything from fitness to nutritional foods to martial arts to help our kids deal with issues like ADHD. We have a resounding success rate, and we integrate mentoring, tutoring, as well as school and social health services. The best part is we provide these services free of charge to the schools, knowing that they're going to give more in use value and savings than it costs to provide our kids with, in many cases, the only care that they're going to receive outside of their struggling families and homes. The second phase is just a matter of reinforcing effective interventions, not just in the schools, but in the community-based organizations where they spend their time. In particular, faith-based organizations who provide the overwhelming majority of charity care for vulnerable populations. So, starting with our school-age kids all the way up to our faith-based communities who provide the majority of care for caregivers and other vulnerable members of society, we can easily adapt it to meet the needs of our most deserving. We're talking about our veterans and the families of wounded soldiers.
So imagine you have an aging veteran who has multiple chronic diseases, is depressed, doesn't have a job, and needs food and housing. The fact of the matter is multiple government agencies are providing services for this individual, but none of them knows what the others are doing, so there's a lot of fragmentation, duplication of effort, and complexity. Well, FIRES.org is like an intelligent glue. We have relationships with a number of best-of-breed nonprofits in the community, which allows us to offer wraparound services to anyone who needs public health or social safety net services. Working together, we serve the needs of the whole person, and sharing an information service makes it easy to improve safety, quality, and efficiency. It's our goal to improve nonprofit capacity, performance, and sustainability in ways that are attributed directly to participation in our program. So check us out, FIRES.org. We're already making a positive difference in the lives of many, and we look forward to doing so with you. We're in expansion mode, so all it takes is for you to reach out. We'll be standing by and look forward to making a positive difference in the lives of many with you.
That's the beauty of FIRES. We're going to enhance the lives of millions, giving them hope, giving them a solution, and then preparing them. Because if a person receives the proper help, then that person is now equipped to reach back and help somebody else. That's what it's all about.
Absolutely.
You know, that's why when I think of FIRES, for the people, by the people, serving the people. This is a people thing. And Sisters United is a grassroots organization, been going strong for 17 years. We are your foot soldiers that are daily on the ground, actually touching, talking, hugging, wiping the tears away from our clients. One of our programs is a re-entry program, helping incarcerated individuals that's about to be released or have recently been released that need help, you know, getting acclimated back into society. You know, well, we're doing it. Unfortunately, these men and women are released with the clothes on their back that they came in with and maybe a transit ticket to get to their destination, which means they will be another body in society that's unable to be productive because of that blemish. But in the meantime, because they are human beings, they're going to require basic things in life: food, shelter, clothing, employment, education. Therefore, that means that we're going to have safety nets in place to accommodate these individuals, helping them to get acclimated back into society. That's where FIRES come in and all of the special services that we have to offer. So all the things that I stated, we as FIRES collectively have the resources to help these individuals become productive citizens.
It's amazing you say that, Reentry is difficult whether it's from the prison, the ER, or a nursing home. The same services are needed, and they don't require a government agency or new taxes or even legislation. It just requires cooperation.
You said nothing but the truth. Look, it can't fit. This is something taking the kids off the street. They're getting educated. They're getting mentored. They're building social skills. They're building relationships. They're getting healthy. They're learning how to eat healthy. They're learning the value of nutrition. They're not on a corner. They're being taught by real men and women, where the males are learning to pull your pants up. You feeling me?
Yes, indeed.
You know, we have young ladies, they're learning their self-worth.
Absolutely.
You know, they're building their confidence. Man, that's priceless.
Epilogue. Who says health reform has to be painful, costly, and slow to deliver desired results? Why can't we create self-sustaining jobs that strengthen and expand the safety net so it can be there for anyone and everyone who needs it most?
Once we recognize what we have to do, once we pray about what we have to do, once we roll up our sleeves and start doing what we're supposed to do, you're going to see a better society.
Public health and social safety net.
That's the bottom line. Fires incorporates everybody, you know.
Inclusive.
No human being is left out, regardless of race, religion, ethnicity, sex, gender, economic level, educational level, demographic area. None of that matters. If you have a need, Fires is there to meet that need. If there's something we can't help you with, we will go out of our way to find a way to help you or find the answer. So Sisters United, we have two major mottos. Don't talk about it, be about it. And while you're talking, I'm working. You know, there's not a lot of discussion needed. We all know what the ills of society are. So my thing is, in the discussion, focus that energy on actually now doing the work.
That's right.
You know.
That's right.
Also, we have the resources and connections that if they need housing, we can help them find housing, so they don't have to go through the stress and red tape of.
So you've done the hard work for them.
Yes.
Yeah,
We
dig
have food bank, so if they are in need of nutritious food, we can provide that. We have access to clothing if they need clothing. We also offer career training, computer classes, help them to get to GEDs if they have not gotten that. We also have connections to try to help them get into unions that are willing to work with those with misdemeanor records. So there are resources out here. If they have the desire in their heart to do better and make a transformation to be productive, one phone call to Fires and, you know, tackle many of their obstacles.
Well, if you're a health or social worker or a nonprofit, we invite you to join us, Fires.org, who will provide the tools, training, and support that's needed for you to make the most of the opportunity at hand while leveraging the strengths of other nonprofits with complementary interests and needs.
Now everyone's on the same page, getting better outcomes in less time and for lower costs. That's what this is about.
That's the beauty with Fires. We can say it's a one-stop shop. You know, it's definitely a one-stop shop.